Okay, today's I'm going to be doing a presentation on type 1 diabetes, or the correct way to check your blood sugars. For this educational activity, I chose a 21-year-old female with type 1 diabetes, newly diagnosed. I'm going to focus on teaching her the correct way on checking her blood sugars and the importance of why to check her blood sugars. Type 1 diabetes is a lifelong disease in which there are high levels of sugar or glucose in the blood. And it is important for you to check your blood sugars, because if not, you can be at risk for having high blood sugars or low blood sugars. Patients normally develop high blood sugars by not taking the correct amount of insulin or eating unhealthy. Those are the things. And signs of hyperglycemia consist of fatigue, excessive weight loss, or rapid weight loss. They normally complain of feeling sick, thirst, things of that sort. But taking too much insulin or exercising vigorously, patients may present with hypoglycemia, and that's they present with hunger, fatigue, shakiness, headaches, confusion, dizziness, shady skin color, normally signs of hypoglycemia. According to the systematic review I recently read, it showed that with self-monitoring of blood sugars and with extensive education, it reduces the patient's risk for developing those conditions, and in turn decrease their hemoglobin A1C. Hemoglobin A1C is a blood level, common blood level, that's used to diagnose type 1 diabetes or type 2 diabetes, and it's like an average over 3 months. It normally presents in a percentage. Normally patients below 6.0 normally don't have diabetes. Range from 6 to 7 is at risk, and over 7 they normally diagnosed with type 1 or type 2 diabetes. First and foremost, when patients that have diabetes are checking their sugars, you're going to probably have a monitor, which is going to be ordered for you. Have one at home that you'll check before and after meals, and probably at bedtime. Your special device may not be as bulky, may be easy, and you want to take that everywhere you go. If you go on vacation, you would take that blood sugar monitoring system with you, so that way you can assess yourself and check your blood sugars, especially when you're feeling anything but normal. You're going to know you're normal, so you're going to be able to tell after a few years or even sooner when you feel like your sugar's high, you feel like your sugar's dropping. You're going to learn all those things. But first thing is having a machine. Your machine is going to be SAT programmed. It needs routine maintenance or checkup, but for the most part, it's going to come with a power button. Simple to find. It's on the center, on the side somewhere, but it's going to come with a power button. It's going to come with some strips. Those strips are coded. They normally have a blue or pink spot on there that shows you exactly where you put your place of blood on there. And it's also going to come with lancets. And the lancets, when you prick your finger, you put the drop of blood. I'm sure you've done it plenty of times. When you went for your doctor visits and not really knowing the importance of what exactly they're doing. So I'm going to demonstrate to you the correct way to do it, and then I'm going to ask that you return and demonstrate it on someone else to see that you get the hang of it. Very simple, but very important. Okay, the first thing to do is put your machine on, and you set it. And I'm going to just use a code on this one, but for your own machine, you want to have a code. It's probably going to be a power on, power off button. Okay, and your lancet is probably going to come with tiny little needle. The correct way to do is to get on the side of your finger. Some people go in the center of the pad, and you're going to find out what's comfortable to you. But finger sticks are what we do on either one of the fingers. And it's good to rotate fingers because it's going to become tender, but you'll get used to it. And the correct thing to do is to have an alcohol prep. Some people use an alcohol prep. Some people don't use anything. It's your choice. But for example, today I'm going to use an alcohol prep on you. And what I'm going to do first is take your finger, one swipe, let it dry, and then I will stick right here on the side. And with that drop of blood, I'll just put it on the paint strip. Whenever it turns blue in the back, I stick it in the machine. Sometimes it takes anywhere from about 15 to 30, 40 seconds, and then you get a reading. And I didn't do it, I didn't stick you, but you'll get your reading on your screen. And anywhere from 80 to 120 is where you're trying to be. You strive to be. Anything higher than that, you would want to kind of monitor what you eat and taper down. If you're on insulin, you'll have parameters where you inject yourself insulin. Okay? Do you pretty much understand how to do a blood sugar check?
Yeah, I think I can show you how to do it.
Okay. Let's see. We're not going to stick anybody for real, because I don't think you want to get stuck per se just yet right now. I know you've probably already got checked this morning, but I'm going to ask that you show me exactly how to do it on Miss Cassie.
I'm going to keep filming.
Okay.
Okay, first, I'm going to turn my machine on. Have my test strips ready. And my lancet to stick her finger. And best case scenario, alcohol swab. So I'm going to wipe your finger with alcohol swab once. Let that dry a little bit. And I'm going to stick on the side of the finger. Once I've done that, I'll have my strip ready. And use that one drop on my strip. Make sure the back is blue. And wait 30 to 40 seconds for my results.
Great job. Okay, Cassie. Great job checking her blood sugar. This concludes my video on the correct way to check a blood sugar. It's that simple, but it's very important to check your blood sugars because again, it helps you. It decreases your chances of becoming hyper or hypoglycemic, and a lot of complications present with those conditions. And you're gonna get comfortable as you do it. Continue to practice. Try to check it regularly to help prevent those conditions. This concludes my educational screening.